Hey guys, welcome back to Medical Coding with Blue. So, it is the last day I had any classes at all. I was doing some of the post-conference stuff. So, I just wanted to talk with you guys a little bit, catch you guys up, and let you guys know what's going on. Also, I wanted to address the students that are in the audience because I've been getting quite a few emails and I need to put something to bed, okay? But first off, I'm going to talk about the trip. So today was just a whole day of classes and I just got home. Now, all my Chicago people out there, I will say this. I love your city. It is very, very beautiful. It is gorgeous here. Like Lake Michigan is right outside my window. Like I can see it. It's beautiful. It's gorgeous. I have a problem getting around. Like everything is like a mile is not a mile here. It is like 10 miles. It is, and I'm not being like dramatic, but I'm serious. Like literally my hotel was a mile and a half from the convention center. They said, oh yeah, it's within walking distance. Oh no, 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 no. There is no way that is within walking distance. Forget it. So thank goodness that there's cabs and Uber because that's what I did, you know. And my friend they came in from Italy, wanted to go shopping. Go, have at it. I'm in the hotel. I'm going to enjoy the hotel for my night here. And then tomorrow morning I am off to go travel back home. So have at it. But I am staying right in my hotel. I have walked so many thousands of steps these last few days, and of course I had anticipated it, but I don't know if it's just that it's so much in between, or if because I did more steps than I normally do at conference. This one literally kicked my butt. So I was just like, no, I'm done, you know. So enough of my complaining. I just wanted to talk to the students that are in the audience or people who are thinking about becoming a medical coder because like I said, I don't know what happens. I think it's like maybe like there's like a whole crop of people that starts out with a new credential, like they're just registering into school or something, and they look and they find me, you know, which I'm glad you guys are here. Thank you for being here. But I wanted to talk about something that's very important. Now, I'm going to seem a little motherly. Okay, I'm not a mother, but I'm going to sound a little motherly. Now, if it seems mean, don't take it as it's being mean. I am looking out for what's best for you. Only because I've been there, done that, and I got a t-shirt. You know what I'm saying? Like, I know what it takes to become a medical coder. There are two people that become a medical coder, okay? There are medical coders who study with books and flashcards. Not on the phone, not on a tablet, not on a some other little electronic device. These are people that actually go to a library, actually look at physical books, actually look at flashcards or write flashcards out. There's those type, and then there's the other type. There's a type that are working with electronic devices, maybe on their phones, or you know, going to websites and you know, doing little flip things online. If that's the way you learn, okay. If you want to stick to doing PDFs on your phone or looking on the computer or whatever, and you don't want to touch a book, and you can still learn, then okay. But like I said, there are those two types of people. Now, I've talked to a lot of students, and I've had experience with lots of people, okay? The people that I notice that capture what's going on right away and are less confused are the people that are physically looking at books, physically working with flashcards, physically doing something other than being on their phones or on their computers, okay? There's those kind. And then I see the people that are constantly confused, or maybe they feel lost. Now, sometimes they're working with books and they still feel lost, and that's a teacher issue, okay? Because I think that if they're not being taught properly, but they're still, you know, doing the heavy lifting, like working with physical books and doing flashcards, I think it's like a teacher issue. It could be like maybe the teacher isn't explaining it in a way that's helping them to understand. And then there's people who are on their phones not taking notes, and they feel lost and confused and they don't understand why. And they want to, somebody did send me this question, which test was easiest? No. I will not help anybody who asks me which test is easiest, because if you're trying to get into this business and you want it because you want to get the easiest way in, and just because you think that you're going to make all of this money, you are in for a wrong thing, okay? You're in it for the wrong reasons. Don't do it, because not only are you wasting other people's time, what you do is going to affect people. It's going to affect the most vulnerable patients at the time that they don't need somebody who is going to be not as caring about their information or not as caring when it comes to coding their encounters correctly. You know what I'm saying? And just doing whatever just to sort of get revenue in, whether you're trying to just code it right away and not really paying attention. This can affect that patient. The amount of money that they have to pay. You know, if you're selecting the wrong procedures, if you're selecting the wrong information, this can affect patients. So don't do it. I'm asking you not to do it, because this probably isn't the field for you if you're trying to get into a field and you make easy money. It makes me mad when I hear people saying, oh yeah, you get to make all this money as a coder and blah, blah, blah. But they don't want to do the hard work. They want to do the easiest one so that they can get in and then just sort of coast along. No, that's wrong. Now, I may be making people mad when I say this, but this is real talk, okay? I'm being truthful with you guys. And another thing, I do not have a certification through AAPC or the other certified billing and coding specialists at CBCS. I do not have those credentials. Please do not ask me questions about those credentials, because I don't know anything about those. I have always directed people to go to the ahima.org website or the aapc.com website, because those are the two major associations that offer medical coding credentials. I don't know anything about the CBCS, and I've said it, and I'm going to keep saying it, and I guess now I have to really say it. I don't know anything about that credential, okay? All I know is it's for billing. You know, it says Certified Billing Coding Specialist, but just because you know how to bill doesn't mean you know how to medical code. Those are two separate things, okay? So if you don't know the difference, please don't send a question saying, what's the difference? Look on the website for whoever's offering that, because I don't even know who offers it, okay? Look on the website. Ask them the questions about that specific credential. Ask them, because they're the ones that's going to be able to tell you. I know about medical coding. I am a certified coding associate, okay? I am a certified coding associate through the American Health Information Management Association. I have been a proud member of them for over 10 years. I will only be with them because I have devoted all of my career to being with them. They have given me so much. I love my association. I love the American Health Information Management Association. I will continue to work towards advancing myself within the organization because I like the way they do things. This is my own personal opinion. There are plenty of good coders with both associations. I'm not saying that one is more than the other one. I'm not saying that. I'm telling you that this is my opinion when it comes to me personally. This is the association that I have picked. This is who I know. I don't know anything about AAPC. I don't know anything about I don't even know who offers a CBCS credential or certificate or whatever. I don't know anything about them. So again, guys, please do not ask me those questions because it's just like I keep repeating the same thing. It's just like, go to the association websites. So if you're new and you're trying to get into the field, I am happy to answer any questions about medical coding. Please do not ask me about specific organizations that I know nothing about. Okay, on my bio on the on YouTube, it even says that I am certified with the American Health Information Management Association. So please make sure that when you're asking a question that you are, number one, very specific. Okay. Number two, please do not ask me which test is easiest, because that's only going to make me mad. Because it makes me mad because it's like you're trying to cheat your way into becoming a medical coder when there are so many people that work very hard to do the job correctly. Just because you have a credential, for for whoever, okay, you need to make sure that you're still trying to learn. I've been in this business for over 10 years and I am still trying to learn. I read the New England Journal of Medicine. Why? Because I'm trying to learn all these other things. And even though, my first love in medical coding is to code podiatry and orthopedics. That is my first love. I love those two. Why? Because I love the bone work. I love injury coding. I love sequela, and I love the disease process of the bones. I do, because that is it is what fascinates me. But guys, I read other things because I'm trying to be as well-rounded as I possibly can. I read an article the other day about obesity. Why? Because obesity affects the joints. When it affects the joints, okay, now I've got to think, oh, well, I need to look at this documentation and make sure I capture that diagnosis if they're addressing it, because if it is affecting the provider to take care of that patient because they're obese, then the provider needs to make sure that he's documenting that. And that is something that if you're trying to do clinical documentation improvement, that's something that you can talk about in a discussion. Now, there is a certification for that. I don't have that yet, okay? Remember, guys, I have slowed down a lot on my speed when it comes to looking up things in the book. When you go take your certification exam, you have to have that speed, and I know myself. So I am working on it, and there's a lot of things that's going on behind the scenes that I don't necessarily talk about right away because I need time to work on them, but I will get to it. But these are the things that when you are as passionate as I am about medical coding, and when you hear things like I've heard in the last week, and not really saying anything, but sort of, trying to figure out a way to say it nicely and politely, of course. But I want you guys to know that this is not an easy field to get into. And if you're looking for a good paying field that you think is easy, and you think, oh yeah, medical coding is just, you just put in a few keywords and boop, you get your code. No, there's a lot more to medical coding than that. And I hope that if you are watching this video and you're considering maybe being a medical coder, that you still do your research, that you look at AHIMA.org and AAPC.com and you check out what they can offer you. Get on the customer service hotline and ask them, hey, I'm interested in becoming a medical coder. What does your association offer? Or can I go, how much is it to go to your online courses? Because both of them have online courses, but it takes you as a student, as a person that's trying to get into it, to also know and understand what it is that you're looking for. Because I can't tell you which association to go with. I can't give you that sort of idea of what to do. That's on you. That the onus there is on you. Okay, but if you want to change your life, if you want something that's going to give you good mental stimulation and challenge you every day to be more open and to learn more, this is the field. This is the field for that. But if you want something that you want an easy job, and you don't want to have to work very hard, you don't want to study, you don't want to read, this is the wrong field. This is the wrong field for you. And I'm just being honest. I'm not trying to discourage anybody. You've seen my other videos. If you've watched my videos, you've seen that I do encourage everybody. But if you are trying to get out of it as with as little studying as possible and not really trying very hard, this isn't for you. I'm just going to be honest with you there. You know, because you still have to continue to learn. You will always have to continue to learn. So I'm going to go ahead and close this out because I want to try to do a live tonight. I'm going to see if I can do that. I tried to do a live before and I didn't really like how it came out because I was on the waterfront and it was really grainy. So, but I do want to do that. And sorry for, being stern. But at the same time, when it comes to medical coding, I do take it personally. I'm just saying. So, but if you are looking for advice on medical coding, that's fine. Let me know. I'm still stockpiling questions for Q&A Tuesday next week. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will talk to y'all later. Bye.